We have Anne-Marie here today, and I talked her into doing a couple treatments. So, you know, as birthdays accumulate, we start to show wrinkles in her neck. So aging starts to happen in her neck. And although Anne-Marie is young and beautiful, even at this stage of her life, she could stand to have a little bit of improvement with a couple treatments we're gonna do. Now, the first one is banding. Show us your bands, please. See, when she does that, we get these bands right here and right here. And the first treatment we're gonna do is we're gonna use one of the neuro relaxers or neurotoxins to help soften those bands. So we're gonna start out by using Dysport. And I love Dysport for this treatment. It's really great. And go again and show us those bands. Now, hers are not prominent when she's not making that expression. So this is gonna help her a lot because it's gonna soften her. Because a lot of people animate, and Anne-Marie, you're a very animated kind of gal. And so this is really gonna help. Now, if they're just hanging there without facial expression, it's gonna help a little bit, but it's not gonna improve it as much as this will. So this is a super simple treatment. We're gonna just use a few units of Dysport and make that expression again. And this will start to take effect in about 3 days or so, and the maximum effect is 1 week. So I love that. It's a great add-on. It's not expensive, and it just softens the whole face. And so you can see when she tilts her neck down, she has some of these lines that are just from movement. And they also talk a lot about this with the, I forgot what the actual name of it is, but when you're looking at your cell phone, you're looking down, and so they're saying that the creases in your neck are getting worse. Now, I think this is a made-up thing that people like to talk about because in cosmetic surgery, we like to be on the forefront and talking about new things. People have read books prior to the cell phone, and they've read newspapers, and so, I don't know. Anyway, I'm not a total believer in it being a new phenomenon. But anyway, we're gonna see just how easy this is. And we take a filler, and my filler of choice for this treatment is gonna be a very small particle filler that stays in place, and it's called Defyne. It's a Restylane product. I love this product for fine lines only. For thicker lines or saggy, baggy skin, I have other favorites. Okay, so here we go. Anne-Marie was a little nervous. She asked me before we started, she said, is this gonna hurt? And what did I tell you, Anne-Marie?
Some sort of lie about no.
And it's not gonna bruise. Now you can see this is a pretty quick treatment. Afterwards, I recommend that you may wanna do a treatment with a device called a Sublime, and that helps to get this into position. Anne-Marie did the lip lift. Tell them about the lip lift while we're here.
Lip lift was my favorite thing I've ever done. Doctor likes to corner me and make me do things. Peer pressure's thick. And I actually wanted him to learn how to do the lip lift, and then once he did, I was like, uh-oh, why did I do that? But
and I think you were our very first lip lift, weren't you?
I was the third.
Third? You were the third?
And then I figured, well, at least he has to work with me so he won't make me look terrible. So let's have that going.
I always get nervous when I do something new on somebody I have to work with because I'm like, oh my God, especially when they're a superstar like Anne-Marie.
But I get to have, so I have a nice pretty lip. So my lip was long and it just hung there. So he shortened the distance from my nose to the actual pink of my lip. And then, so my lips now are just my lips. I'm kind of a ducky person anyways, so. But
it just gives it a little bit more of that pink like she was saying, it's great. Now, the other thing is if you look at Anne-Marie's neck, this is her week of the neck for Anne-Marie. So she did this, you can see these little track marks here. This is a sublative, and what it does is it actually helps to tighten the skin. And it's really nice because you can see this is how many days out, Anne-Marie?
3.
3 days? Yeah. Just 3 days. And by day 5, she won't even have that grid pattern. So it just looks like I mean, from a distance, you barely notice it.
And I could put makeup on it if I wanted. I just kind of don't care.
Actually, the more beat up a person looks, the more interested people are. We had one of our staff just get a CO2 laser around her eyes, and you know, during her roughest period, that was when people were most interested, and we had the most people book for it. It's kind of interesting. Okay, now we've got a little bit left, so do you mind if I do a little bit on the cheeks?
Yeah.
Or do you want to just...
how about my right side?
Right side? Absolutely. So again, this is really for fine lines. I hate to waste anything. And you can see on the neck, we only used a half a vial. And so here we go. Just a little bit into these fine lines. Okay, so today we did the little bit of filler in those necklines, and we also did that little bit of Dysport to soften those banding, and she's also had this ablative, and she's a new woman. So thank you for tuning in. Please follow us on Instagram, Facebook, YouTube, and thank you all for being so supportive of our channel.